Hello, everybody, and welcome to Functional Solution Podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with me today, we have Dr. Chill.
Hey, everybody.
And Dr. Chill is a functional medicine physician who has years of experience with using functional medicine, clinical nutrition, herbal medicine. And the reason that we're doing this podcast is because we're super passionate about helping providers just as yourself to build up established practices, build their practices, grow them, and make a meaningful change in your community's health and well-being. And so if you're interested in learning about how to establish your own virtual practice, what are the tools that you need to use, what are the tools that can save you administrative time, that the must tools that you have to operate a virtual practice, and to figure out what is your niche, what is the clinical process, what is my marketing process, how do I get clients or patients to fill up my schedule? How do I attract my ideal client, right? The client that values your skills and your time and is willing to pay for your services. So if you're interested in learning all of these, we'll be happy today to share with you the process that we have used and our graduates in our programs have used to build a successful practice. So my experience and my journey is of going through the years of building a successful practice was very interesting. In the first 7 years, I tried everything I possibly heard of. I read all the books, went to marketing conferences and all of that, and I struggled financially. I was helping patients, but I was struggling financially. I was fighting insurance companies to get paid. I was trying different ways to get patients in the door. And while I was actively seeing patients and I was helping patients get really great results using the root cause approach and clinical nutrition and herbal medicine, financially, it was a whole different story, right? And so once I learned the strategies and systems, right, sort of like a recipe to building a successful practice, I was able to completely transform. Within 3 years, we became so profitable. We grew to a team with physicians, nurses. We had acupuncturists, we had nutritionists, we had a health coach. It was a wonderful experience, and we were able to change a lot of people's lives. I know that Dr. Chill, the reason I asked Dr. Chill to join me, do this podcast, because Dr. Chill has a tremendous amount of experience with business beyond his MBA degree. Dr. Chill also built a brick and mortar practice and then sold it, and then now it transitioned to online, to virtual care. So what was some of your experience, Dr. Chill, in terms of the business?
I'm so glad we're doing this podcast today, because not only this is like a big passion of mine, but we get a lot of coaching calls from students in this program going into different businesses and how they can go about doing that. So I'm glad that we're doing this, because we wanted to give you the system for that. And as Dr. Cohen was saying, I have an MBA, but that MBA really didn't do anything until I got into practice. And it is completely different from a health perspective and a health business perspective on what to do. So we are going to break down what we learned in the process. As Dr. Cohen was saying, I built a brick and mortar, actually built a few brick and mortar practices. And then I recently sold one in San Diego and have transitioned to a few online programs, and where I'm able to do automations with those programs. So I wanted to be able to teach you everything that I learned in the process and kind of give you some of those systems. And that's what we're kind of doing today for you. So we want to break down the system for you so you can easily apply that to your own business.
Exactly. And one of the issues that we're seeing, and this is exactly why we want to support practitioners, healthcare practitioners, not just in the US. We also have clients and community members from Canada and kind of across the world in other countries. But the reason why we're so passionate about this is because being in healthcare is not easy. As a healthcare practitioner, you show up every day for your patients, regardless of what happens to you personally or financially, or your mood, or if you want to be there or not. You show up every day, and you're there to serve your patient and help them to improve their health, to reduce suffering, right? To hopefully get a meaningful change that will change their quality of life, right? And the system is just built in a way that is unfortunately very abusive towards healthcare practitioners. The amount of stress that providers go through in a hospital with long hours, 5 to 7 minutes appointments, it's very stressful. Like Dr. Jacobo, one of our community members, was sharing with me. He's from Mexico, and he shared with me that his life was just so stressful. He was seeing like 40 to 60 patients a day, right? He was running around from room to room. He was trying to fill up their prescription as quickly as possible. He didn't have time for his family. It was costing him in his health, right? And at some point he stopped and he said, like, I got to stop this madness, because if I'm gonna keep on doing this, I'm gonna accumulate more stress, more health problems. I'm definitely missing out on my kids growing up, and I don't have, like, my quality of life is just terrible. And not only that, but am I really helping my patients, or am I just temporarily managing their symptoms? And once he got out of that, he understood that there's a different way. Then he came in and we showed him how to do it. But it's interesting to see that when I look at the statistics, it really reflects the journey that I went through. Like, when you look at the statistics, only 1 out of 10 businesses succeeds in 10 years. And most businesses fail in the first 2 years. The first 2 to 5 years, that's where most businesses fail. And the problem is not lack of resources, right? Tony Robbins always says, it's not the lack of resources, it's the lack of resourcefulness, right? And the problem was that I struggled in the first 7 years because I did not have a system or a recipe. And I always say a recipe because I like to cook, I like to bake, right? So if you're trying to make a chocolate cake without a recipe, you know that it's going to be a disaster, even if you have the right ingredients. You got the eggs, you got the flour, you got this. It's still, if you throw it in all in, not in the right measurement and not in the right ratios and not in the right timing, not in the right temperature, it might look like a chocolate cake, but I promise you it's not going to taste like a chocolate cake and nobody want to eat it. I'm talking out of experience. So what we're going to give you today took both me and Dr. Chill several years to learn. We invested a lot of money in coaching, a lot of money in learning this material. I personally invested over $100,000 in learning this material. I still invest a lot of money in mentorship from people from very high leagues. And the result is, after 7 years of making a lot of mistakes, cost me a lot of money. I remember signing in with 3 marketing companies. And I don't know if any of you had that mistake, but I remember one of them made all these promises, right? I was struggling and I saw the ad and they said, we're going to make you $100,000. You're going to make $100,000 in the first 2 months. And we guarantee it, right? And I remember signing in, it was like $15,000 or $20,000. And I signed in, I didn't have that money. So I borrowed from this credit card and that credit card. And it was nothing. It was just it was, I didn't get any patients from that. I wasn't able to grow my practice from that, right? The only person that gained from that is the person that sold me on this marketing scheme, right? So today I know, I can smell it. Like we work today with different marketing companies, but today I can smell it when someone tells me, make $100,000 from just working 6 hours a week. I just recently saw that ad on Facebook. Make $100,000, just work 6 hours a week. I'm like, just run. Don't walk away from that and run, because we know that building a business takes time. It takes dedication, and it takes real strategies, not fluff, right? So this is where we want you to learn from our mistakes. We want you to learn the right way to do this. And this is why Dr. Chill and I are going to talk about the process and exactly what it is that you need to have in place to have a successful practice, right? And I really like to, as when we do those summits, the practice building summit, and we work with you like live, building, showing you the systems and unfolding them and showing you how to build all of this. One of the things that I like to tell everybody is have a goal. Like the goal could be as simple as, I'm just going to add $3,000 or $5,000 to my monthly revenue. And then we figure out how many patients do we need for that, right? So always have a goal. That could be a very, very small goal. But let's say you just want to add, $4,000 to your, that's your initial revenue. Let's say you just want to add that, just that 4,000 cash, right? You want to add that. That would be if you charge $150, which is really low, right? Because most functional medicine practices charge a lot more, right? How much does the average functional medicine practice charge, Dr. Chill? What have you seen out there?
Yeah, it's anywhere between $150 an hour to even $1,250 an hour. So the range is pretty broad, depending on experience, what the practitioner thinks they can get, and then also even location. So there's a few different variables that are involved with how much people are charging, and then that's just on a one-on-one basis. And there's a myriad of structures for even fees for different programs that are out there as well. And this is something that we'll cover in the practice building program within the American Academy of Functional Health. And I am really glad that you're kind of bringing up some of the things that we have gone through. I've kind of gone through the same thing. I've spent over $100,000 as well on coaching, different marketing aspects, different advertising. We have done it. We have done many different things to kind of get to this point in our career. And our goal with this podcast is to narrow it down for you and for you to learn from our mistakes. So we're just giving you all of the pieces that we've learned, all of the systems that we've learned, the recipe, as Dr. Cohen was talking about, so you can put the pieces and the items and the ingredients of the business recipe together in the correct way. And that's what we're going to go through today.
Yes, exactly. So we want you to learn from our mistakes, to learn from our success for what works and what doesn't work, instead of spending years of trying different things or paying marketing companies or different gimmicks, different, I'm not going to call it a sham, but I'm going to call it a gimmicks out there, and all the done it for you type of, you just tell you that you're just going to sit at home and patients is just going to flow into your practice without you doing anything. You can have a successful practice. It's not, it's not rocket science. You can have there's a process, there's a recipe. I've done it. Dr. Chill have done it. Our graduates are doing it. You can do it too. So we're just telling you that when you follow a process that is proven to work, you can do it too. And if we just take, like Dr. Chill mentioned, it really ranges between $150 from a starting point per hour. You can charge all the way to $12.50. You'll be surprised. I mean, I've walked in New York a couple of years ago, and I saw a clinic. They're charging $950 for their first evaluation, right? $950. Like, how many patients do you need to make good money when you charge $950 for the evaluation session? You can do it with one patient, like one patient a day, right? One patient a day times 5 times 4 weeks, right? That's easily $16,000 to $20,000, right? If you have 2 patients a day, if you really want to work hard, let's call it work hard, right? 2 patients a day. I mean, they're making probably $35,000 to $40,000, I'm assuming, easy every month, right? So obviously, and we know it's New York City, and we understand that it takes time to build your reputation to get there, but you got to start somewhere, and that's okay. So even if you start with $150 and you just want to get to $4,000 a month, and that's like a good starting point, then really all you need is 6 to 7 appointments every week. That's all, right? And when you see one patient, if you do the consultation properly and set things in advance, that patient will come back the following week or 2 weeks later, right? So you already have another patient coming up on a regular basis, right? So we're going to talk today about how to fill up your schedule. We're going to talk about strategies, but we want you to think about, you got to start, where am I right now and what is my goal? And you need to set it up and decide that you are committed to getting to that goal, because it's not always a straight line like some of those marketing companies will want to draw a picture of. It's more like this, more like a little roller coaster ride. And the reason why we have coaching calls and we have classes and we have ongoing check-ins and we have ongoing on-demand classes, on-live classes, is because we want to make this as enjoyable and as smooth for you as possible. So instead of being like this, it's more of like this, right? All the way up to the top. So hopefully you got a pen. I would recommend to have a pen and a notepad ready. We're going to take some notes. So we're going to divide this into 6 or 7 steps to make it easy to consume and to understand. And so step number 1 is going to be, what is your niche? And by niche, I mean what, who, and where. So by what, I mean, what are you focusing on? And I would recommend to not be a generalist, even if you're coming in from internal medicine and you're a generalist, general practitioner, right? Even if you're a chiropractor, right? And you just focus on pain. Remember that pain could mean different things to different people, right? For patient number 1, if they see your ad and you say, I specialize or I focus on pain, right? Or root causes of pain, that for somebody with back pain, that could mean you're focusing on back pain. For somebody with digestion problems, abdominal pain, that could mean that that they might think, oh, this guy is specialized in digestion, right? Conditions. So the more focused you are, the better. And you want to think about conditions that are having patients that are very motivated, right? So if I go to work with patients that have depression, it's going to be harder for me to enroll them in my services than patients that are struggling with joint pain, because joint pain is a very high motivating factor, right? So that's the what. Who is, of course, who we're working with. Women, men, what ages are they? Are you want to work with younger population? Are you working with teenagers? Are you working with elderly folks? Those are really important to think about. And then where are they? And that's what I want you to think about. Once you know what you're focusing on and who these people are, where are they found, right? So we're going to talk a little bit more about those, but that's your first marketing tip. Like, where are they found? If I'm specializing in joint pain, where can I find these people? Oh, I can think about support groups, right? So support groups might be a good way. I can Google support group for joint pain in my city, right? And I can find these people and I can reach out to them and I can present myself and create a collaboration and all of that. So that's number one. What is your niche? Dr. Chill, take us into step number 2.
Step number 2 is all about messaging, right? So how are you getting your message across to these patients and then, or these potential patients, and what is your message? What I have seen in my practice and what I've seen with other practitioners is most people are not caring about how much you know. They're actually really caring about how much you care about their progress and their health and what you can do for them. It's really not about what you are, it's about what you can do for them. What is your mission? And a tip for this is you can actually do something that you're really passionate about, right? So you might have had some firsthand experience with this, either for yourself or you might have had a family member that's gone through something. This is going to help you with your messaging and then with your niche. So for me, I struggled with cystic acne for years, and it was functional medicine and naturopathic medicine that healed it for me. So I understood my patients, what they went through, what they struggled with, their day to day. And so that message was really clear to my patients or my potential patients because I went through it myself. And then I knew what their pain was. And so I was able to hone in on that message, and it showed that I cared, and I cared about their health and their progress. And this really got me a lot of patients because I understood their struggles. So when you're thinking about messaging, what you want to do is look at their struggle, their pain points, and how are you going to alleviate those struggles and those pain points for them. And like, as I was saying, the tip is to either have some sort of firsthand knowledge with that, or have had some a family member or a close friend or relative that's gone through that, or it's something that you're really passionate about because it's something that your patients are struggling with. So you're seeing firsthand what they're going through and how you've helped with them. And so that's what they're really going to be caring about, is how you can relate to them and then how you can heal them.
Yes. And that could be very powerful. Your message could be one of the staples of your marketing, because like Dr. Chill said, people don't care how much you know until they know how much you care. And if, for example, you don't have a story to share that is, like Dr. Chill mentioned, personal, yourself, a family member, you can think about a patient that came to see you and shared their challenges, and they cried in your office, and they tried this and they tried that, and it really touched your heart. It really was something that was, it really moved you, right? And that's the reason why you're doing what you're doing, right? Of course, we all want to get a paycheck in the end of the day or the end of the month, but there's a reason why you are in healthcare and not in another profession, for example, just sales, right? So share that. That's a powerful thing. That could be in a written message on your website. It's more powerful if it's in a video recorded with your phone. It doesn't have to be perfect, but you got to get it done. It's never going to be perfect. Like as much as we create things, and we are getting better and better at this game. When I look at things that I thought were amazing like 2 years ago, I'm looking at it today, I'm saying, what was I thinking? I could have done it so much better, right? So every time you're going to look back at something, kind of like the way we used to dress, right? If you look at your pictures from the 80s or 90s or whatever it is, you're going to think to yourself, why was I wearing those jeans, those tight jeans, the tight skinny jeans? Like, what was I thinking to myself, right? So fashion changes, your opinion of things changes, and that's okay. It doesn't have to be perfect. It just needs to be done. Step number 3 is, what do you do to get them result? So this is where we have the patient flow. And the patient flow is really important for you to understand where are we taking them, right? So what is the process, right? Jacob, can you put in the picture of the process? So you're going to see on the screen the picture of a process. This is a part of our functional medicine certification training. So you're going to be able to see from left to right. This is what we call the truth process, that we call the truth. And essentially, the first one is the triggers. So we want to identify the triggers of inflammation, chronic disease. R is for reviewing the results of your screening tool and functional lab analysis. So we got a screening tool that we provide our functional medicine, and you can use labs, you can use all of those other tools. The screening tool is a functional medicine evaluation tool that does not cost any money. So it's a huge advantage for you and your patients. Then the U is unique plan to your patient with guidance to address the root cause. T is for treatment using evidence-based protocols. And then H is for harmonize your immune system, your gut, healthy function, all of that stuff. So have a process in place in which you take them through this. And if you don't have a process, you can borrow the process from us. The truth process, you can borrow it from us and use it in your practice. That's our mission. We're here to help you to change your community's health and your finances. Do something that you love doing. Step number 4 is getting clients. So Dr. Chill, take us a little bit through getting clients and what is some of the marketing processes.
Yeah, the biggest thing with getting clients, and I actually get asked this all the time from many practitioners, is how do I get clients? And it really comes down to your marketing process. So if you are just starting out, you don't have any patients at this point, you need to figure out a way to start an activation campaign, right? To get this. And this can be done through organic traffic, through social media, or it can be done through paid ads through social media. And this is going to be one of the easier ways to kind of start to send your message, as we were talking about earlier. Start to just describe your patient flow, and social media are some tools that you can use to help you get that messaging across to activate your campaign. So with social media, I was stating about organic traffic and paid traffic. Paid traffic is going to cost more, but it's going to start to get you potential clients faster. Organic traffic, these are going to be things where you're posting educational content or informational content, pictures, images, those things. That is going to take time to start to gain some followings, and then some people to click on your link to your website, and then to kind of get you into like maybe either like a booked call or a discovery call. Those are some ways that you could do that. It's just going to take time to do that. So what I would recommend is to maybe look into some paid ads or even just boosting your posts. And that just costs like $5 to $10 to boost your posts on your Facebook ads or your Instagram posts that you have. Now, when you are doing those posts, you want to make sure that it's as educational about what your services are as possible. And then also that it is linking to a landing page, which we're going to get into, right? So now that you're focusing on like how to kind of get clients, we kind of want to go into the process on how to nurture those potential clients. There's other things that you can also do, which is free marketing. This is the old-fashioned way of marketing, which is doing lectures and doing talks. So I've coached a few practitioners that have been giving lectures. a few of them were starting out and they didn't know how to nurture those potential clients when they were giving those lectures. What you can do when you're giving those lectures is have some sort of system that they're going to go into so you can continue to communicate with them. And that's where we're going to go into with this funnel and this process. And it's going to make doing those talks a little bit more effective to getting clients for you in the door, and then for them to maintain that loyalty with you as well.
Yes, absolutely. So far, to summarize it, you can do free social media, which is essentially you post an educational post. We have different materials that can, as an example, that we provide, but essentially, for example, top three supplements for treating diabetes, right? Or top 2 diets to benefit patients with arthritis, right? So there's different ways to create, right, to create more interest in the community. You can also boost that, like Dr. Chill said. And then there's also, if you want to do a completely free marketing, there's the old-fashioned way, which is essentially we call the signature talk. And the signature talk is the talk that you go out and do in the library or a support group or a church. And that is one of the best way to create yourself as an authority. Of course, we can take that and you can take your signature talk and transfer it online. One of the things that we do in the Practice Building Summit is we actually teach you our signature talk and how to customize it to yourself, to your own niche, your own practice. We even give you the whole signature talk that we have and use so you can adapt it to your practice. And one of the things that I learned is that a good signature talk that is professional, that is proven and went through the test of time, it could be worth $100,000 to some practitioners. To other practitioners, it'll be worth $500,000. To other practitioners, it'll be worth over $1 million. So the only way we were able to scale from struggling financially to $1.7, $1.8 million a year is by having a solid signature lecture. And that was the recipe and the blueprint for success. So when I would go out to do, or one of the physicians that work with me would go out to do the diabetes talk or arthritis talk or this talk, we always used the signature talk. That is the most important thing. Otherwise, you're just winging it. And, if, as Einstein once said, if you keep doing the same thing, you're going to get the same results. So if things are not working for you, if you're not making the income that you want, you're making 100K or 50K, you want to make 200K, right? If you're making 200K, you want to make 500K. If things are not working the way you want them to work, you have to change the strategy. Because again, if you keep doing what you're doing, you're going to end up with the same results again and again. So this is where we have the step number 5, which is the funnel. And the funnel is really important because once you get some traction, you get some people looking, you get some eyeballs, people that are interested in what you put out there in social media, or if you go physically to do a lecture in the community, right? You get some people that are interested in what you're doing. We want to get them through the funnel. Let's put a picture of the funnel so you can see sort of why we call it a funnel. So essentially a funnel, this is called the new patient flow, is designed to take potential clients into loyal customers. So each phase of the funnel has certain I would say, methods of communication. There's a certain script that we use for each one of those 4 phases. 1, we get their attention. Are we working with diabetes or working with chronic patients with joint pain, right? Are we working with Alzheimer's or working with neuropathy, right? We want to figure out what it is, and then there's a certain script we use. Then we provoke interest, right? So at this point, They're interested in what you have to offer because you offer something unique. It's not just another prescription of medication and then goodbye, I'll see you in 6 months, right? This is more of a personalized medicine when we figure out what caused them to become sick. And we help guide and coach them towards health and well-being. Then we create a desire, what is their health goal? And then we move them towards action, which is to pay and book the appointment on your schedule, right? That could be $150 to your pocket, $250 to your pocket. If we do programs, that could be $3,000 or $5,000 or $9,000, right? So, or if we do membership, then they pay you every month, right, on a regular basis. So that's the stuff that we want to figure out, and we want to put it together. That's why it's called a funnel. We funnel them through the process. Of course, we're doing everything in an ethical way. If they're not a good fit for us, we don't continue them in the funnel. If they're not a good fit for us, we refer them out to somebody who is a good fit for them, right? So everything that we do is educational. It's not about selling. It's not about us. It's about them, right? So this is where we get into, we want to get leads, interested leads. We want to get them into the funnel. And the funnel is really composed out of, you got the landing page, you got the webinar, you get the book a call. And Dr. Chill, take us into a landing page. So somebody comes in, they saw us online, let's say on social media, or they saw us giving a talk, and then we give them a link to go to register. Like, where would that, especially with a virtual practice, right? What would that landing page look like?
Yeah, so this is going to be really, really important, right? Because now that you've done all the work with the social media, the activating campaign, doing the talks, now you have this this list that you're working from, right? This list of potential clients. What you want to do is nurture them, and what's called nurturing them. And you're going to take them through the elements of this funnel that Dr. Cohen was talking about. And some of the specific elements are the landing page, the webinar, and then booking a call with them. So in the landing page, it's really important that this is a standalone web page. It's not like a website that you might see where they're kind of exploring and looking at different things. This is going to be it's a very narrow focus, because you've already talked to them. They've already gotten to know you through some of your social media posts, through some of your advertising and your marketing, through your lecture. So now we're going to continue to vet them and ensure that they are the right client for you. And this is what the landing page can do. The purpose is for when the visitor goes in, or the potential client, they land on this page, which is a website, and they're going to be clicking on a link that you're going to provide them, either through your Instagram, your Facebook, your LinkedIn, or when you're giving the talks, you could even have that link of that landing page on a QR code that they can scan right then and there, add in their information, their name and their email, and then you're going to have their information where they can go directly to this landing page. And as I was saying, the focus and the goal of this landing page is to have them get to a specific goal, which is called a call to action, or a CTA. And this is important because this is going to help your potential clients clarify who this webinar, what you're doing, what your program, what your practice, what your services are, and who they are for. It's also going to give you an opportunity to collect data through the forms that I was speaking about, and it's going to allow you to continue communicating with them and with these potential clients. Now, there are some key items that a landing page should have. It should have a catchy headline, and we discuss all of these items a little bit further for you in how to build a virtual practice in your practice building program. And then it's also going to have a sub headline, and then some visual elements. And then it's going to have a brief description. This brief description should be concise. It should explain the offer, the product or service, and it should focus on the benefits rather than the features. And as I was saying before, it should also have a call to action, right? This is the CTA. This should be very prominent and clear. It should state exactly what you want them to do. So if you have a ebook that you want them to download, you want to say download now. If you want them to sign up today, it should just say sign up today. For this purpose of this funnel that we're talking about, what it should include is something like watch webinar now, because what we want them to do is to get some more information on you and how you can help them by going to a webinar. And so the call to action for this landing page for this purpose is going to say watch webinar now. And then the form should be simple and easy to complete for them. Once they click on that watch webinar now, it should take them to a form. It should only have their name, their email, possibly their phone number. It should be very, very easy for them to fill out. And then you might have on this landing page social proof or testimonials if available to build more credibility. It should be optimized for mobile because most people, about 70 to 80% of potential clients, are doing this through their phone now. They're not necessarily doing this through their computer. So this should be optimized to the mobile, and it should be very easy to navigate. As I was saying, it's a single focus to the call to action on that one page instead of what a website is where they're exploring. It's the focus goal of getting them to the call of action, or the call to action, which is getting them to the webinar.
Yes, and you guys can see on the screen as Dr. Chill was talking, we gave an example of what a landing page looks like, so you can see the different features. Jacob, can you put that on again? So you can see there's a title and there's a subtitle. Essentially, the title is what is it that they want what is their end results that they want. So for example, here, this is a landing page that we have for individuals, for healthcare practitioners who are looking for an advanced level functional medicine program. So we start with how to choose a functional medicine program, and we give them 6 tips. For example, if you're a practitioner, then we recommend to go to a practitioner level program rather than a coaching program. If you are interested in the clinical application of functional medicine, then our program would be a good fit. If you're looking for a theoretical program, then from our experience, IFM does that better than us. And if you're looking for academic, then University of Western States does a better academic program than us. So if you're looking for 10 hours a week of writing papers and review and research, then University of Western States is a better place for you. If you're looking for just learning about the pathophysiology and discussions, then IFM is better than us. If you're looking for a clinical program that is focused on the treatment protocols, the labs, what do I do with complex patients or chronic patients, then that's what we do best. So we give them tips. You can see they put in their name, email, phone number on the right side, and then they click yes, and it takes them to the next page, which is your webinar page. And so the webinar page, you can remove that, Jacob. So the webinar page is essentially the next page. So that's the thank you page. It's simple, and it's just it's literally, it just has an embedded video with the title on top, and it has you delivering your signature talk. And you can try to create that yourself. We have a proprietary system that we deliver. We can give you as a member of our community, as a student in our advanced program. You get that from us at no additional charge. As I mentioned, a good signature talk is worth over $100,000, because that is the powerful tool that can transform your patient, your potential client into a loyal patient, right? That sticks with you for months and months and is willing to pay and commit to time, investment of money, and all of that stuff. So the webinar is important. That's your key signature. You can do it. You can do a live workshop. You can do it online if you're doing a virtual practice. Once you set it up, this thing works for you 24/7. When you're sleeping, patients go in, they put their name and email, and they watch the webinar. When you're out on a holiday, enjoying during Christmas, you're going with your family to ski. That thing still works for you 24/7. That's the magic of having an automated funnel. Now, there are massive benefits, and the reason why we say the signature talk is very important, it's because it's an effective tool for generating high quality lead. It attracts the people that are really good fit, the people that watch you and they say, wow, I really resonate with this person's mission. I connect with you. I feel like you care about helping me, right? It builds yourself as an authority. So you now become an authority in the field that you're talking about, right? And it educates and trains your patients to understand the root cause. Instead of, using their insurance to get a prescription, they're paying to get a valuable service that they cannot get with anybody else. So that's the importance of, you can do all of this and more, right, when you got the right signature talk. So that takes them on the bottom of your signature talk. You always want to invite them to book an appointment with you. If you're doing it live in the community, there's different ways to do that. We're not going to get into that because we focus on the virtual side today. But there are online, all you got to do is just have a schedule open on the bottom of the page. And it doesn't have to be sophisticated. It could be really simple. It could be a simple Wix.com, Wix.com website that has the landing page with the example that we showed you today. And the next page is the video with a schedule underneath that, right? So keep it simple. Very, very simple. And then they book an appointment. So in the end of your signature talk, you say, I'm looking for the 5 people that are committed, they're interested, and they're serious, they're interested, and they're committed to transforming their health. If you are one of those 5, put yourself on my schedule. Let's get on a call, right? And this is where Dr. Chill is going to tell us about the call, which is really important. So Dr. Chill, take us through the booked call.
Yeah, so the whole point of the entire funnel system, right? From getting the leads from your social media, your talks, getting them into the webinar, having the call to action in the webinar, which is the book call, and scheduling a call with you. Usually at this point, if you've done a good job with your landing page and the webinar, and we show you how to do that, they're going to be extremely interested in your services, and they're typically ready to get started, or they're at least ready to get some more information so you can stay in contact with them. So for when they are ready, again, this is a whole vetting process to ensure that they're the right client for you, so you're not wasting their time and they're not and they're not wasting yours. If they're not the right type of client for you, you could refer them out to other practitioners at that point. But the point of the booked call is for you, because they have gone through the entire funnel system, they're ready to get started with you. You at this point can start walking them through your entire program, your services, and then the point is to get them enrolled into your into your program, into a one-on-one consultation with you. And so that is the whole entire funnel system, from marketing to landing page to webinar to booked call into the enrollment. And a tip for you, when you are doing your scheduling page or even your webinar, is that it is recommended that you create an easy to remember domain for your booked call, so they can remember this, so they can click on that scheduling page or that domain. So an easy to remember is something like www.chatwith, for me, it was chatwithdrchill.com. So for you, it could be chatwithdryourname.com or chatwithsusieq.com. Something that's really easy for them to remember. So when they're going through the webinar, they can easily click on that link. Or let's say they get distracted, they can remember that name and just click on that later to schedule that call with you. And then that's going to take us to some tools that you can utilize once they have gone through the entire system. And these are going to be tools for you to be successful as a practitioner when you have patients going through your program, your services, or your consultation.
Yes, absolutely. So we wanted to kind of summarize everything because we want to make sure that we have sufficient amount of time to go into the additional factors that we have to consider when we have a virtual practice, which is the softwares that you're going to be using. So we got some specific recommendations, and then we also have specific recommendations for labs, like what are the 3 or 4 top labs that you want to have ready to go for those patients. So we're going to cover that as well. And then additionally, how do you set up your supplements? How do you automate the process? And where can patients find and book all of those? So we're gonna, to make sure that we have enough time to talk about all of those, we'll cover all of this in our next session that we're gonna be doing. So make sure that we can elaborate on that and kind of give you, after years of using different companies and different products and different services, what really works the best, what can save your patients money, and what labs can give you the most amount of data for the amount of money that the patient is paying, right? Because that's what we want to do. We want to save money for our patients whenever we can, and we want to provide the service that is comprehensive, right, for the root cause. So just to summarize it, we got the funnel, and we also know that we have the systems that we talked about, right? So we got the funnel, we take them through this 4 steps. We have the 5-step, the truth process. When we find the root cause, you can go back and pause this, watch it later again, and pause and take a screenshot of each one of those that we talked about. And of course, we dive into each one of these systems that we talked about in the practice building program. So the practice building program is essentially where we design with you a successful practice. This is not just you watching on-demand classes on the new patient flow or your signature talk, or how do I do a professional and successful consultation, right? How do I have people coming in and I engage them and I enroll them in how do I have them say yes to my offer, right? Because again, it's not about my income. It's not about, how much I'm charging. It's not about what it will do for your bank account, right? It's none of those. It's really focusing on them, right? So doing the process of enrollment in a friendly, in a professional way that patients value your skills and value your time, and lead them and coach them in a way that they will tell you, yes, I want this. Like, how do I enroll in your service? How do I enroll in your membership or program? So our practice building program, it comes with classes on demand where you can watch, whenever you want, 24/7 access. But we also have a summit where we work with you in each one of those 5 aspects, and we give you the signature talk. We give you the health expert framework to become an authority instantly, and the new patient flow and the consultation, the whole thing. So I hope that you enjoyed. I hope it was beneficial for you. In the next in the next sessions that we're going to have, we're going to talk about the top labs, the essential labs you must have to have a comprehensive care to your patients. We're going to talk about the tools. What would you use for landing page? What's the most affordable EMRs you can use for functional medicine virtual care? We'll talk about all of that stuff and how to automate your supplements. But for now, we're giving you some food for thought, and we want you to understand the overview. That's the most important thing of the system and how to apply it. And hopefully you already got some valuable tips from that. And so I really want to thank Dr. Chill for being here, for sharing his process and what works and what doesn't work.
Always a pleasure.
Absolutely. Always a pleasure having you. And as usual, I'm very grateful for each one of you for being out there, for investing in your skills, investing in providing the best quality care, most updated treatment protocols, and the best new patient flow for your patients. So for changing their health. So I appreciate it. And I hope you take care for now. And for any of our students in our community, go to the practice building section, start learning, getting deeper into these classes. And I will see you in our next discussion. Take care and have a good evening.